Ghaith Prometric Mixed Questions and Answers, Part 2.
Acid-base balance. Rule of the bees. If the pH and the bicarbonate are both in the same direction, it is metabolic. If they are in different directions, it is respiratory. Respiratory or metabolic. The pH is high, the bicarbonate is high, is metabolic. The pH is low and bicarbonate is low, it is metabolic. When the pH is high, the bicarbonate is low, it is respiratory. Or pH is low and bicarbonate is high, it is respiratory. Acidosis or alkalosis. For the pH greater than 7.45, it is alkalosis. And pH is less than 7.35, it is acidosis. The normal pH is 7.35 to 7.45. The normal bicarb is 22 to 26. The normal carbon dioxide is 35 to 45. Compensated or uncompensated. For uncompensated, if the PCO2 or the bicarb are normal. For partially compensated, if nothing is normal. Well compensated if pH is normal. Example, the pH is 7.30, it is low, and the bicarb is 20, it is low. So it is considered as metabolic acidosis. Another example, the pH is 7.58, it is high, the bicarbonate is 32, it is low, it is considered metabolic alkalosis. For the respiratory, example, the pH is 7.22, it is low, bicarbonate is 30, it is high, it is in opposite direction, so it is considered as respiratory acidosis. In metabolic alkalosis, there is an excess of bicarbonate in the body fluids. It can occur in a variety of conditions. It may be due to the digestive issues like repeated vomiting that disrupt the blood acid-base balance. Another example is nasogastric tube suction. Cushing syndrome can also be due to complications of conditions affecting the heart, liver, and kidneys. Who is at risk for metabolic alkalosis? People who experience severe bouts of vomiting can get metabolic alkalosis. It's also common in people who are critically ill or in the hospital for certain conditions. The risk is especially high if you are dehydrated or need your stomach pumped gastric suctioning. You may need suctioning to rid your stomach gases of abdominal fluid buildup and poisons or a medication overdose. What are the symptoms of metabolic alkalosis? Irritability, muscle twitching, muscle cramps, muscle spasm, fatigue, confusion, tremor, tingling and numbness, abnormal heart rhythm or arrhythmia, seizures, and coma. Metabolic acidosis is a condition in which acids build up in your body. Causes include untreated diabetes, the loss of bicarbonate in your body, and kidney conditions. Symptoms include an accelerated heartbeat, confusion, and fatigue. Blood and urine tests can help diagnose it. Treatment may include sodium bicarbonate, IV fluids, and insulin. Metabolic acidosis can develop if you have too many acids in your blood and wiped out bicarbonate. If you lose too much bicarbonate in your blood as a result of kidney disease or kidney failure. Symptoms of metabolic acidosis: 1. Tachycardia. 2. Fatigue, confusion or dizziness, loss of appetite, breath that smells sweet or fruity, rapid breathing or long deep breathing, nausea and vomiting, headache, feeling weak. What are the examples of metabolic acidosis? 1 is diarrhea, ileostomy, dehydration. Respiratory acidosis is primary increase in carbon dioxide, partial pressure, with or without compensatory increase in bicarbonate. pH is usually low but may be near to normal. Points. Respiratory acidosis involves a decrease in respiratory rate and or volume hypoventilation. The common causes include impaired respiratory drive, example, due to drugs, medication, or CNS disease, and airflow obstruction, example, due to asthma, COPD, or chronic obstructive pulmonary disease, sleep apnea, airway, and edema. CPR and drowning are one of the examples of respiratory acidosis. Treat the cause and provide adequate ventilation using tracheal intubation or non-invasive positive pressure ventilation as needed. While respiratory alkalosis is a primary decrease in carbon dioxide partial pressure with or without compensatory decrease in bicarbonate, and the pH may be high or near to normal. Chronic form of respiratory alkalosis is asymptomatic, but the acute form causes lightheadedness, syncope, confusion, paresthesis, and cramps. Signs include hyperapnea or tachypnea and carpopedal spasm. Key points for respiratory alkalosis. Respiratory alkalosis involves an increase in respiratory rate and or tidal volume or hyperventilation. Hyperventilation occurs most often as a response to hypoxia, metabolic acidosis, increased metabolic demands, example fever, pain, or anxiety. Questions for acid-base balance. A 12-year-old boy was brought to the emergency room with respiratory arrest due to drowning. Cardiac resuscitation was done. What is the major complications that might happen if treated after drowning quickly? A. Sepsis. B. Alkalosis. C. Acidosis. D. Hypothermia. The answer is C. Acidosis. Example of respiratory acidosis are CPR and drowning. Gastric suction can cause A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. The answer is C. Metabolic alkalosis. The ABG reading was low pH, high carbon dioxide, and normal bicarbonate. What is the interpretation? A. Compensated respiratory acidosis. B. Uncompensated respiratory acidosis. C. Metabolic acidosis. D. Metabolic alkalosis. The answer is B. Uncompensated respiratory acidosis. In this question, the pH is low, the PCO2 is high, so it is respiratory. And the pH is low, so it is acidosis. The bicarbonate is normal, it is uncompensated. So the answer is uncompensated respiratory acidosis. The nurse assesses a client with an ileostomy for possible development of which of the following acid-base imbalances? A. Respiratory acidosis. B. Metabolic acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. The answer is B. Metabolic acidosis. Patients with ileostomies, biliary or pancreatic drainage may develop significant metabolic acidosis due to enteric bicarbonate loss and volume depletion. The nurse is assigned to care for the patient with Cushing syndrome on adrenal corticoid hormones syndrome or adrenal corticoid hormones with pH of 7.2. Which of the following conditions should nurse expect to patient? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. The answer is D. Metabolic acidosis. A nurse reviewed a chart of a 42-year-old woman whose EBG analysis reports is shown. pH is 7.20. The PCO2 is 35. The bicarbonate is 20. Which of the following is the most likely interpretation of the findings in the report? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Metabolic acidosis. The answer is D, metabolic acidosis. The rationale of this report, the pH is 7.20 is low, the PCO2 is 35 is normal, the bicarbonate is 20 is low, so they are in the same direction, low, so it is considered as metabolic. The pH is 7.20 is low, so it is considered as acidosis. So the answer is metabolic acidosis. A 20-year-old woman, a case of panic attacks, comes to the emergency department. An arterial blood gas analysis is done. The pH is 7.53. The normal is 7.35 to 7.45. The bicarbonate is 22. The normal is 22 to 26. The PCO2 is 27. The normal is 35 to 45. What is mostly likely? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Answer is respiratory alkalosis. Rationale of this data, the pH is 7.53. It is high. The bicarb is 22. It is normal. The PCO2 is 27. It is low. It is in opposite direction. So it is considered as respiratory. And the pH is 7.53. It is high. So it is alkalosis. So the answer is respiratory alkalosis. Intravenous solution, general knowledge. Isotonic. Examples. 0.9% sodium chloride. Lactated ringer, ringer solution, and 5% dextrose in water. Hypotonic. 0.45% sodium chloride, 0.33% sodium chloride, 0.2% sodium chloride, 2.5% dextrose in water. Hypertonic. 3% sodium chloride, 5% sodium chloride, 3% sodium chloride or 5% sodium chloride plus D5 water, greater than 5% of D5 water, example, D10 water. A client was admitted in the emergency room due to mild metabolic acidosis associated with dehydration, and the doctor administered Hartmann's lactated ringer intravenous fluid and electrolyte replacement. Which of the following elements of the lactated ringer solution highest value? A. Calcium. B. Sodium. C. Potassium. D. Magnesium. The answer is B. Sodium. The lactated ringer components are: lactated ringer is considered as which type of IV solution? A. Hypotonic. B. Hypertonic. C. Isotonic. D. Hyperalimentation. The answer is C. Isotonic. Physician orders an intravenous fluid of D5NS at 100 cc per hour. This is an example of which of the solution? A. Hyperalimentation. B. Hypertonic. C. Hypotonic. D. Isotonic. The answer is B. Hypertonic. A 13-year-old patient is admitted for diarrhea and vomiting. He looks pale and lethargic. A nurse is preparing to give IV hypotonic solution. Which IV solution is most appropriate? A. 0.9% saline. B. Lactated ringer. C. 10% dextrose in water. D. 0.45% sodium chloride. Answer is D. 0.45% sodium chloride. CPR questions. You are performing CPR on an infant. When a second rescuer appears, what is the next step in management? A. Immediately transport the patient. B. Wait until exhausted, then switch. C. Have the second rescuer help with CPR to minimize fatigue. D. Have the second rescuer begin ventilations at the ratio of 30 to 2. D. Answer is C. Have the second rescuer help with CPR to minimize fatigue. What should be your first concern at the scene where a person has been seriously burned? A. Checking the scene for safety. B. Checking the victim's breathing and pulse. C. Calling your local emergency phone number. D. Calling the burn area. A. checking the scene for safety. While performing cardiopulmonary resuscitation or CPR on a 5-year-old child, the nurse palpates for a pulse. Which of the following sites is best for checking the pulse during CPR in a 5-year-old child? Femoral artery, B. Carotid artery, C. Radial artery, D. Brachial artery. The answer is B. Carotid artery. After activating the emergency call system, what should be the next immediate action? A. Initiate ventricular pacing. B. Administer a bolus of lidocaine as prescribed. C. Defibrillate the patient. D. Open the patient's airway. The answer is C. Defibrillate the patient. A nursing instructor teaches a group of students about basic life support. The instructor asks a student to identify the most appropriate location to access the pulse of an infant under 1 year of age. Which of the following, if stated by the student, would indicate that the student understands the appropriate procedure? A. Carotid, B. Popliteal, C. Radial, D. Brachial. First D. Brachial. Chest tube questions. Nurse is transferring a patient with chest tube to the X-ray department for chest X-ray. Which location should the nurse place the chest tube? A. Directly on the stretcher in an upright. B. On the side of the stretcher next to the patient. C. Hang on IV pole that is attached to the bed. D. Attached to the stretcher and hang. Answer is D. Attached to the stretcher and hang. A 40-year-old male patient has a chest tube and properly fixed following cardiac surgery. The chest tube is patent and functioning. When the nurse removes the dressing, the tube falls out of the chest. Which of the most appropriate initial intervention the nurse should take? A. Reinsert the chest tube and notify the surgeon. B. Apply an occlusive dressing to the insertion site. C. Place the open end of the tube in 20 centimeters of water. D. Administer oxygen at 10 liters per minute via non-rebreather mask. Answer is B. Apply an occlusive dressing to the insertion site. While attempting to get off the bed, a patient accidentally disconnects the chest tube from the pleural evac drainage system. Which of the following actions should the nurse take first? A. Insert the end of the chest tube in a container of sterile solution. B. Raise the end chest tube above the level of insertion of the chest tube. C. Clamp the chest tube near pleural evac drainage system. D. Apply pressure dressing to chest tube insertion site. Answer is A. Insert the end of the chest tube in a container of sterile solution. The nurse is caring for a client who has just had a chest tube attached to a water-sealed drainage system. To ensure that the system is functioning effectively, the nurse should A. Observe for intermittent bubbling in the water and seal chamber. B. Flush the chest tube with 30 to 60 ml of normal saline every 4 to 6 hours. C. Maintain the client in an extreme lateral position. D. Strip the chest tube in the direction of the client. Answer is A. Observe for intermittent bubbling in the water-sealed chamber. A client chest tube is connected to a chest tube drainage system with a water seal. The nurse noted that the water seal is fluctuating with each breath that client takes. The fluctuation means that A. There is an obstruction in the chest tube. B. The client is developing emphysema. C. The chest tube system is functioning properly. D. There is a leak in the chest tube system. The answer is C. The chest tube system is functioning properly. You are assisting a physician with the removal of chest tube. What activity may be the physician have the patient to instruct to perform while the chest tube is being removed? A. Valsalva maneuver. B. Leopold's maneuver. C. Chest physiotherapy. D. Half cuff technique. Answer is A. Valsalva maneuver. Valsalva maneuver is taking deep breath and hold when it is removed to prevent air from re-entering the pleural space. Half cuff technique is forcibly remove phlegm by forcing inhaling, holding it, and actively exhaling. 67-year-old man is admitted to the post-anesthesia recovery room following chest surgery. The patient has a right chest tube that is attached to a low suction. 3 hours after admission to the unit, the nurse observes the drainage output from the chest tube is 300 milliliters. What is the most appropriate initial intervention? A. Notify the doctor. B. Reduce IV infusion rate. C. Strip tube with roller device. D. Reposition in left lateral decubitus. First A. Notify the doctor. The nurse is caring for a client who has had chest tube insertion and connected to water seal drainage. The nurse determines the drainage system is functioning correctly. When which of the following is observed? A. Continuous bubbling in the water seal chamber. B. Fluctuation in the water seal chamber. C. Suction tubing attached to a wall unit. D. Vesicular breath sounds throughout the lung fields. Answer is B. Fluctuation in the water and seal chamber. Infection control general knowledge. Airborne. Tuberculosis is epidemic disease. Coronavirus, measles, chickenpox. Droplets, smallpox, meningitis, diphtheria, rubella, influenza, streptococcus. Contact, RSV or respiratory syncytial virus secretions, MRSA, secretion from body fluids, staphylococcus, and Ebola virus. In tuberculosis, TB is an epidemic disease. For TB, wear a 95 mask. The test is Mantox test or PPD test. The test should be done within 48 to 72 hours. Isoniazid for TB, side effects, numbness, hepatitis symptoms, stomach upsets, and rashes. The accurate test for TB is sputum culture and to be done early morning. Meningitis, streptococcal pneumonia. Meningococcal vaccine is given. Patient symptom is neck rigidity. Mode of transmission is droplet. The test is cloudy as cerebrospinal fluid. Lumbar puncture. Wear surgical mask, no need for N95 mask. An 80-year-old man is diagnosed with tuberculosis. A negative pressure room was given. Which of the following should you wear a mask? A. Patient's healthcare providers. B. All people who enters the patient's room. C. Persons has close contact with the patient. B. All people who enter the patient's room. Which of the following is an example of epidemic point source? A. Tuberculosis. B. Public health agency. C. Contaminated water source. D. Communicable disease pavilion. Answer is C. Contaminated water source. Mr. X attended an outpatient clinic with symptoms of shortness of breath, diarrhea, and severe respiratory distress. Which of the following is the best diagnosis of Mr. X? A. Coronavirus. B. Swine flu. C. Zika virus. D. Hepatitis. Answer is A. Coronavirus. A nurse receives a telephone call from the admission office of the hospital and is told that a patient with streptococcal meningitis will be admitted to the medical unit. The nurse is planning to apply infection control measures for the patient. Which type of isolation precaution the nurse must observe? A. Droplet precaution. B. Contact precautions. C. Airborne precautions. D. Standard precautions. Answer is A. Droplet precautions. 16-month-old child in hospital in an intensive care unit with multi-resistant sepsis. On the third day, she had explosive diarrhea. A stool sample was sent to the laboratory for Clostridium difficile investigation. Which of the following transmission-based precaution is most appropriate? A. Combination of airborne and droplet. B. Contact. C. Droplet. D. Airborne. Answer is B. Contact. Which of the following is the most effective infection control precaution to prevent nosocomial infection? A. Hand washing before and after patient contact. B. Wearing gloves and masks for direct patient care. C. Isolation precaution. D. Broad-spectrum antibiotic. The answer is A. Hand washing before and after patient contact. Mantoux test is done for a patient and the result was 6.5 centimeters and it is considered as A. Latent, B. Suspected, C. Active. The answer is B. Suspected. A patient in surgical ward was transferred to isolation room after the wound swab confirmed to have methicillin-resistant Staphylococcus aureus or MRSA. Which of the following measures should the nurse take to prevent infection in the ward? A. Clean the wound 3 times a day. B. Discard all soiled dressing into the waste bag. C. Instruct the patient to wash hands regularly. D. Wear gloves and gown on every entry into the room. Answer is D. Wear gloves and gown on every entry into the room. A 5-year-old child is seen in the primary care clinic with mild fever, headache, and malaise for about 2 days. And today he has rash filled with fluids. Which of the following is the best suggested diagnosis? A. Chickenpox. B. German measles. C. Measles. D. Scarlet fever. Answer is A. Chickenpox. An 8-year-old boy presents to the pediatric clinic with his mother who complains that the child has developed a skin rash. There is a clear drainage from the nose and he appears tired. The rash first appeared on the face and then spread over the trunk and is now beginning to appear over the hands. Some lesions show open ulcerations and others have crusted over. There are scratches marks over the skin. Which findings would indicate the child is ready to return to school? A. Normal body temperature. B. Dry and scabbed lesions. C. Nares of free of drainage. D. Absence of rash over trunk. Answer is B. Dry and scabbed lesion. A 33-year-old woman has come to the outpatient clinic for treatment of a vaginal infection. Physical assessment reveals yellowish, excessive, thin, offensive, and fruity discharge. Which of the following is the most likely diagnosis? A. Candidiasis. B. Trichomoniasis. C. Bacterial vaginosis. D. Chlamydia. Candidiasis, it is caused by yeast infection with white patches, redness, and soreness of the vagina. Trichomoniasis, it is a foul-smelling, white, yellowish, gray, or green genital itching, redness, and fruity discharge. Bacterial vaginosis, it is a strong, fishy, or musty odor, itching or irritation, discharge, light and gray, white. Chlamydia, it is a change in vaginal discharge with bleeding after sex, with pain discomfort in the lower abdomen, burning sensation when urinating. A patient with colostomy complains of itching of the peritoneal skin. On assessment, the skin is covered with a red rash and white patches visible. What is the most likely cause of this condition? A. Not changing the pouch regularly. B. Candidiasis. C. Consuming acid-producing food. D. Dehydration. Answer is B. Candidiasis. A 5-year-old child is seen in the primary care clinic with headache, malaise for about 2 days, and today he had a fluids on the nares and on the skin. For how long the child should be isolated after formation of A. 2 days. B. 6 days. C. 10 days. D. 15 days. Answer is B. 6 days. For chickenpox, the isolation is 6 days. A toddler is seen in the emergency room with history of high temperature for 5 days. He had watery eyes and had a cough for the last 3 days. And then he developed a rash all over the body which started in his face and spread down to his body. The mother did not remember the vaccination schedule of her son. For how long the child should be isolated? A. 5 days. B. 10 days. C. 15 days. D. 20 days. Nurse is assessing a 65-year-old patient who reports fatigue, weight loss, night sweats, and a productive cough with thick sputum. The nurse should immediately initiate isolation precaution for which of the following condition? A. Influenza. B. Pertussis. C. Bacterial pneumonia. D. Tuberculosis. The answer is D. Pulmonary tuberculosis. Which of the following diagnostic tests is definitive for TB? A. Chest X-ray. B. Mantoux test. C. Sputum culture. D. Tuberculin test. The answer is C. Sputum culture. A patient presented with high fever, headache, vomiting, and neck stiffness for the past 3 days. Which of the following is the first diagnostic intervention for this patient? A. Urine and stool analysis. B. Lumbar puncture with CSF aspiration. C. Complete blood count. D. Chest and abdominal X-ray. Answer is B. Lumbar puncture with CSF aspiration. The nurse is assigned to care for a patient with Ebola virus disease. Which of the following is the most common mode of transmission for Ebola virus? A. Vector. B. Airborne. C. Direct contact. D. Common vehicle. Answer is C. Direct contact. A nurse is carrying a patient diagnosed with pulmonary tuberculosis, and she has to wear a 95 mask when she enters to the patient room. Based on the cycle of infection, which of the following is the reason to use the mask? A. Break the transmission chain at the portal of entry. B. Break the transmission chain at the portal of exit. C. Kill the agent exists in the patient's room. D. Eliminate the reservoir of the bacteria. The answer is A. Break the transmission chain at the portal of entry. Which of the following is the primary level of prevention? A. Detect and treat existing disease. B. Prevent illness or injury occurring. C. Reduce the extent and severity of health problem. D. Minimize disability and restore to prevent function. Answer is B. Prevent illness or injury occurring. A nurse is in surgical unit prepares for a wound dressing. While she is preparing, she sneezes over the dressing trolley without wearing a face mask. Which of the following is the most appropriate action should a nurse take? A. Set up a new sterile field. B. Put on a mask and continue working. C. Continue working in the most sterile field. D. Replace the equipment she thinks is contaminated. The answer is A. Set up a new sterile field. Thyroidectomy questions. A patient returned to the surgical unit from thyroidectomy. The nurse observed that the patient is non-arousable. The blood pressure is 90/60 mmHg. The heart rate is 108 beats per minute. What immediate action should the nurse take? A. Recheck pulse and blood pressure. B. Administer intravenous fluid as ordered. C. Place client in modified Trendelenburgs. D. Assess the back of the neck for surgical dressing bleeding. Answer is D. Assess the back of the neck for surgical dressing for bleeding. The complication of thyroidectomy. A. Distension. B. Bleeding. C. Vocal cord injury. Answer is B. Bleeding. A post-thyroidectomy patient transferred to the ward and developed tetany. The nurse suspected that patient has A. Hypokalemia. B. Hypocalcemia. C. Hyponatremia. The answer is B. Hypocalcemia. A nurse Wayne is aware that a positive chivostic sign indicate A. Hypocalcemia. B. Hyponatremia. C. Hypokalemia. D. Hypermagnesemia. Answer is A. Hypocalcemia. Chivostic sign, it indicates the twitching of facial muscle when gently tapping on the cheek. General knowledge. Trousseau sign, a sign of hypocalcemia. It is a carpal spasm, can be elicited by compressing the brachial artery with a blood pressure cuff for 3 minutes. While chivostic sign, it is a sign of hypocalcemia or a spasm of the facial muscle elicited by tapping the facial nerve just anterior to the ear. A 29-year-old man is in the surgical ward on his first post-operative thyroidectomy. He appears drowsy, but he is able to respond, nodding his head. He is developing mild restlessness. What is the initial recommended goal of care? A. Monitor vital signs of thyroid storm. B. Assess for bilateral vocal fold mobility. C. Monitor for swelling in the neck. D. Monitor for vocal cord paralysis. The answer is A. Monitor vital signs of thyroid storm. The thyroid storm signs and symptoms are increased heartbeat, increased temperature, increased blood pressure, jaundice, severe agitation or restlessness, and loss of consciousness or drowsiness. A nuclear plant experienced a leakage, and all involved workers were brought to the emergency department for treatment. The medical team prescribed potassium iodide for the workers to block radioactive iodine to be absorbed by the organ in the body. Which of the following organs is the most sensitive to radioactive iodine? A. Brain. B. Lungs. C. Kidney. D. Thyroid. The answer is D. Thyroid. The nurse cared for a 60-year-old woman who has a history of hypertension, hypothyroidism, and elevated cholesterol levels. She takes tablets daily for each of the health problem. The doctor orders a routine dual chest X-ray absorptiometry test that shows decreased bone density. Which medication most likely contributed the test result? A. Statins. B. Antihypertensive. C. Synthetic thyroid hormones. D. Cholesterol absorption inhibitors. Answer C. Synthetic thyroid hormones. The thyroid hormone has a direct effect on bone. High levels of thyroid hormones, either from having an overactive thyroid or from taking too much synthetic thyroid hormone, can cause increased bone turnover, leading to bone loss and decrease in bone density. A 36-year-old man has undergone a subtotal thyroidectomy an hour ago. He is suspected to develop tetany after the surgery. Which of the following symptoms best indicates tetanus? A. Tingling in the fingers. B. Pain in hands and feet. C. Tension on the suture lines. D. Bleeding on the back of the dressing. Answer is A. Tingling in the fingers. The symptoms of tetanus are carpopedal spasm, stridor, and convulsion, tingling of the hand and feet, and around the mouth.